Good day, I'm Hanz Nicole from BSN-3D, and today I will be demonstrating how to administer oxygen by nasal cannula, and the goal of this procedure is for the patient to exhibit an oxygen saturation level within acceptable parameters. For the equipment, check for the oxygen delivery device as ordered by the healthcare provider. These devices can either be a low flow or a high flow device. For this procedure, I will be using a low flow device, which include the nasal cannula. Then, check for the oxygen tubing, the humidifier if indicated, and the sterile water for the humidifier. Check for the oxygen source. And for this procedure, I will be using the wall-mounted oxygen, then the oxygen flow meter, and the appropriate room signs, specifically the no smoking sign, since the use of oxygen means that there is a risk for fire ignition if there is a person vaping or smoking in the room. For the implementation, bring the necessary equipment to the bedside stand or the overbed table. Then, perform hand hygiene and put on your personal protective equipment if indicated. Then, identify your patient. Good morning, ma'am. I'm Hanz Nicole from the NUST, and I will be your student nurse for today. May I know your name, ma'am? And your date of birth? Great, so would you like me to close your curtains and the door to the room to give you a little privacy? Then, close the curtains around the bed and close the door to the room if possible. Then, explain to the client what you are going to do and why you are going to do it. So today I will be giving you your supplemental oxygen using these devices. This procedure is good for you because it will allow you to breathe easier. Review safety precautions when oxygen is in use. Place the no smoking sign in appropriate areas. And for this demonstration, I will be placing this sign on the client's door. Next, connect the nasal cannula to the oxygen setup with the humidification if one is indicated. Then, adjust the flow rate as ordered by the physician. However, in emergency cases, this procedure can actually be an independent nursing function, and we can adjust the flow rate at 2 to 3 liters per minute. Then, check that oxygen is flowing out of the bronch by simply placing our hands in front of it and feeling for air that is passing out. This is to check for the patency of the tubing and determine if there is an obstruction. Place the prongs in the patient's nostrils and to determine if the placement is correct, this flap should be pointed downward. Then place the tubing over and behind each ear with the adjuster comfortably under the chin. And alternatively, we can place the tubings behind the patient's head with the adjuster comfortably under the base of the head. And if possible, we can also use or place gauze pads at the patient's ear behind the tubing to ensure that there will be no skin irritation. Adjust the fit of the cannula as necessary. The tubing should be snug but not too tight against the skin. Then encourage the patient to breathe through the nose without using the mouth. Okay, ma'am, can you try to breathe using your nose and without using your mouth? This is to ensure that the client can breathe in the oxygen. Then reassess the patient's respiratory rate, effort, and lung sounds. and note any signs of respiratory distress, such as tachypnea, nasal flaring, use of accessory muscles, or dyspnea. This is to evaluate if we have met or achieved our goal. Remove PPE if used and perform hand hygiene. Then, document the procedures done on the patient, the oxygen device used, the flow rate, the patient assessment, the physical assessment, and the time that the oxygen was administered. Then, at least every 8 hours, or according to your policy recommendations, we need to put on gloves, remove and clean the cannula, and assess the tubing for patency, assess the client's nares for any irritation or bleeding, such as any redness, pain, or inflammation. This ends my demonstration. Thank you for watching.